Hello everybody. Today we are going to learn how to use a multi-channel monitor and a radiant warmer for a newborn baby. Here you can see the machine is on but it is not connected to the baby. The upper green line shows the heart rate as well as the ECG. The middle line shows the pulse oximeter saturation, and the third line, the yellow line, shows the respiratory rate. Here is our baby. We have put three electrodes on the baby's chest: the right upper chest, the left upper chest, and the left lower chest. Here is the left lower chest. So the size of the electrode has to be according to the baby's size, and it has to be fixed firmly on the baby's skin. Now there is a third probe. This is the temperature probe of the radiant warmer, which is fixed on the baby's abdomen, and it has to be fixed firmly because the baby's temperature is constantly being monitored by the machine and the heat is delivered accordingly. Here we have put 36.5 and the baby is also 36.5. So the baby is in thermoneutral environment, comfortably lying on the radiant warmer. Now we are going to attach the electrodes of the machine to the baby's chest. There is color coding on the electrodes. So these are the electrodes. The red one has to be attached on the right upper chest. The yellow one on the left upper chest, and the green one on the left lower chest. Yes. Now once the electrodes are all attached, the baby's heart rate, ECG, and respiratory rate is being monitored by the machine. Now we have to attach the pulse oximeter, the saturation probe, to the baby's wrist. It has to fit properly, snugly, then only it will read properly. And the position of the probe has to be changed every 3 or 4 hours, so that the baby's skin is normal. The baby's skin is not getting any injury from the probe. So you can see that the machine has started showing the readings, but we have to take care that the graph are symmetrical before taking the reading. If the baby moves or cries, the graphs are not coming properly, and we should not trust the reading. We have to calm the baby and then only see whether the graphs of the machine are coming properly, and then only we can take the reading. Here the baby is calm now, and we can see the graphs are also coming down